Okay, welcome everyone to Farrell Pediatrics and South Riding Pediatrics first lunchtime webinar. We are hoping to make this a regular thing where we hop on and do a quick webinar about different topics important to you guys and our patients. So, a little bit about me first. I am Dr. Elena Shea. I am a certified general pediatrician, certified breastfeeding medicine doctor. I'm also an internationally board certified lactation consultant. Personally, I am the mom of three. So these are my three little ones from a few years ago. And I am a bonus mom of one who just last weekend moved out of our house after college. So we are very excited that he is sort of off on his own. I am also a postpartum mood and anxiety disorder survivor with my two older ones. So with these two, I had some pretty bad depression and anxiety. So I have done a lot of learning about that to help my patients. And then when I'm not working or mothering, which is not that much time, but I like to read, I like puzzles and arts and crafts and being outside and kind of taking some time for myself. So let's get going with the question. So, one of the biggest things I get when in hospital is where did they take my baby? So, you go through this whole thing, you have your baby, and you think that you're just going to get to cuddle, cuddle, but then they whisk your baby away to the little heater. So, what are they doing over there? So, the first thing they're doing is having the baby looked at by one of the pediatric doctors. So they're counting fingers, counting toes, weighing, measuring, hearing their heart rate, and listening to their breathing, and making sure that the baby is healthy and ready to go back to mom. The next thing they'll do is what we call preventive care. So this is where they'll put ointment in the baby's eyes to protect it against infection. They'll give a shot of vitamin K to protect against bleeding and do the first hepatitis B vaccine to protect their liver from cirrhosis and liver failure. One thing to note is that lots of hospitals are moving towards encouraging skin to skin, which is putting baby right on mommy's chest as soon as they are born. All this stuff, except the weighing and the measuring, can be done right in mom's arms. So we generally encourage that as much as possible. We know that putting baby right up to mom's skin can help regulate heart rates and breathing and temperature, and it's really nature's way of stabilizing new babies. All right, so next big question is um, do is it normal for my baby to sleep a lot? Parents seem very surprised by the fact that their baby is going to sleep all the time. Normal is about somewhere between 16 and 20 hours, depending on your baby. This is my little one. She's asleep. All her baby pictures are of her asleep. Um, so is it normal? Yes and no. In the sense that most babies are going to sleep a lot. They're going to wake up every 2 to 3 hours to eat and kind of fall into this routine where they are sleeping, then they're eating, then they are awake for a little bit, then they poop, then they fall back asleep. And it just becomes a cycle, a little bit like Groundhog Day. So that is pretty normal. What is concerning, and you might want to talk to your doctor about, is if your baby isn't waking up every 2 to 3 hours. We do expect newborns to wake on their own to eat and kind of do this process. And sometimes babies are just more sleepy and they just really like to sleep, and it's okay. But sometimes it's a sign that there may be something else happening. So if you find that you are having to wake up your baby all the time, it may be a reason to talk to your pediatrician. All right. So another big question we get is breastfeeding or formula. What is best? So a lot of us in pediatrics and a lot of us in sort of the breastfeeding medicine world really encourage the idea that fed is first, meaning that what we want is baby to eat, baby to gain weight, baby to be healthy. We know that human milk is meant for human babies, so it is sort of nature's best option to feed your baby. That said, formula is a medical miracle. We know that formula saves lives every single day. We know that sort of any advantage, excuse me, to human milk versus formula mostly washes out by the time kids are in school. We know that keeping moms healthy is kind of a priority as well. And, one of the big things that we kind of talk about is giving moms appropriate breastfeeding support. So, one of the big things when I'm asked about breastfeeding and prenatals that I told expecting parents is to make sure that they have as much support as they can, both from their partner, from families, from lactation consultants, from their pediatricians. It is very important that we provide moms with the support they need to do whatever their goals are, right? And that's kind of very individual. So, in that light, is my baby eating enough? And this is my youngest. She was exclusively bottle fed, mostly pumped milk, but some good amount of formula. When you are bottle feeding, it's easy to know if your baby's getting enough because you are measuring it. But when you are nursing, it is much more challenging. So, on average, when they've looked at how much a baby takes, they take somewhere between 24 and 30 ounces. And that's, again, a range. There's babies who take less and there's babies who take more, and all that's totally fine. Like we said before, babies eat every couple hours. And the signs of a full baby are the things you would expect. So, baby is peeing, pooping, waking up to eat, they're gaining weight, they're happy between feeds. If you are breastfeeding and kind of putting a baby to breast exclusively or most of the time, it is really a bit of an act of faith. You have to kind of trust that your body knows what it's doing. You kind of have to trust that your baby will tell you if they need more. I found this meme and I thought it was pretty funny. How do you know how much milk does your baby drink? I don't know, boopful. And that's really a big thing when we are talking to breastfeeding moms and they're like, I don't know how much the baby's getting. But the baby's happy and gaining weight and stuff. And so we just kind of trust that their bodies are doing what it's supposed to. This is another big one, especially when parents come in with grandparents and the parents will say, my mom is telling me that I need to put the baby down, that I shouldn't let the baby sleep in my arms. I'm going to spoil the baby. Is this true? And I tell them it is absolutely not true. So babies are meant to be held. It's a big reason why, again, skin to skin is important and it helps babies kind of adapt to being outside of their parent. If you think about back when we were, cave people, babies were carried around all the time. That's kind of where they're designed to be. There's some theories that really babies should cook another 2 to 3 months inside their parent, but because their heads are so big, they wouldn't come out if we let that happen. So we create this fourth trimester where babies are kept swaddled and warm and kind of up to parents' chest. So can you spoil them? No. The other truth is that babies really don't have a lot of long-term memory and habit forming. So holding your baby isn't going to create a habit because they are not able to make habits in that sense. So cuddle away. That's my baby. We did lots of cuddling. Poop. So if you've had a kiddo or you've met with a doctor or pediatrician, you'll know that we are really obsessed with poop. We really want to know kind of how often, what color is it, what's it doing, what's it look like. So what color should it be? As a rule of thumb, as long as it's not black, white, or red, we kind of don't care about the color. We know that poop changes depending on what the baby is eating. Are they breastfed? Are they formula? Is it a mix? So really just letting us know if it changes is a big thing. So babies, when they're born, their poops are dark and sticky, kind of like tar. That is normal. It is them kind of getting all the gunk out from their guts. After about the first week, we don't want to see black poop, especially if it's already gone, to yellow or green. We don't want it going back. So that would be a reason to call your doctor. Green, yellow, brown, orange, all that is normal. Most breastfed babies have mustard, gray poupon looking poops. Formula fed babies, it kind of varies. If you're inclusively feeding, so doing both, it will definitely vary depending on what the baby's getting, what mom's eating, all that sort of stuff. Red poop is never okay. We know that there are some medicines that can cause your poop to turn kind of brick color or red, but a newborn or young baby should not be on these medications. And if they are, your doctor should tell you. So red poop, definitely you want to call your pediatrician. White poop, you definitely want to call your pediatrician, just because we want to make sure there's nothing else happening that's causing your baby's poop to be that way. All right, so here's a kind of quick go. Is it normal for my baby to sneeze? Yes, babies are sneezing and hiccuping and twitching all the time. Their brains are still kind of making all these connections. It doesn't mean your baby is sick. Is it normal for my baby to be noisy? Yes, this is something I did not realize until I had my oldest and I was sleeping with them next to me. And I realized that he is just grunting and making noises all day long. It doesn't necessarily mean anything, especially if they're asleep or you're easily able to kind of settle them down. Is it normal for my baby to spit up? Definitely. Babies have really, really tiny little bellies. And everything we do kind of squeezes their bellies, right? We move them around, we change them, they poop, they pee, they cry, they eat more. So it's pretty normal for their bellies to be kind of squished. And then the muscle that closes their stomachs is
it's a little bit weaker than it is for us adults, and so it opens a little bit and things come up. Pretty normal. If baby is happy, we kind of don't really worry about it. If your baby is really fussy or losing weight or not really eating great, then yes, we want to know about it. Is it normal for my baby to move when sleeping? Yes, just like you. Depends on which sleep cycle they happen to be in. They move and roll and do all that stuff. Is it normal for my baby to sound like Darth Vader? Yes, for sure. Our noses make boogers to clean itself and to keep out dust particles and pollen and things like that. So, we all have mucus and boogers in our nose. Babies have teeny tiny little nostrils, so one little boogie makes them sound really, really congested. Generally, for newborns, if the baby's otherwise okay, so not coughing, not having a fever, family members aren't sick with something, I'm not going to worry that the baby has a cold or allergies or any of that stuff. It's just kind of the way babies are because their noses are so small. Is it normal for my baby to have a goopy eye? Yes, yes. Babies have goopy eyes all the time. Sometimes, if it's really, really soon after birth, we think about could it be infection? Could it be a reaction to the ointment that was put in their eyes? But generally, what happens is babies get tear ducts, they get a clog in their tear duct that then causes their eye to kind of have to make more liquid to keep it hydrated and it becomes a little bit of thing. Generally, that goes away on its own. And, questions, you should definitely see your doctor. All right, I love this one. Is my baby constipated? Probably not. So we know that breast milk helps babies poop. Formula usually doesn't necessarily help, but doesn't hurt, right? We know that babies are supposed to kind of push all that stuff out that they've had in their guts for so long. So babies at the beginning poop multiple times a day. It's really, really soft and mushy. And somewhere around 2 to 4 weeks, that will slow down. And that's usually when we get this call to the office about my baby not pooping every day. And they used to poop 5 times a day, and now they're only pooping every other day. That can be normal. So what happens around that time is that babies are really trying to regulate the movements of their gut, and they have to really think about how it is to push stuff through their intestines. We kind of do it naturally, right? We go to the bathroom, we sit, we kind of push down a little bit and things come out. They're still really learning all that coordination, and it can make them seem like this little picture of my little one, like they are in pain, like they are pushing and straining. Generally, it's this phenomenon known as infant dyschezia, which is just the process of them learning. There's some thinking that babies actually aren't even in pain. They're just crying and straining to kind of increase the pressure in their guts to help things move along. The biggest sign of this is if once they fart or poop, they are totally calm and happy, and what comes out is nice and soft. It's probably not constipation. It's probably this. This tends to get better around 2 to 3 months of life. Can my baby hear? So this is a great one. So babies sleep very, very deeply. And a lot of parents will sometimes ask me if their baby is deaf because they don't seem to respond to anything going around, the dog barking, the toddler climbing into crib, everyone screaming and crying. And we know that when babies are used to a very loud environment, they've been inside their parents for 9 months with heartbeats and water whooshing and intestines gurgling and all that stuff all the time. And we know that that sort of makes it so that they probably are less likely to respond to environmental noises. It's also something that's probably biological, and evolved from when we were cave people, where we didn't want babies crying because it would mean that the saber-toothed tiger would come and eat us. I love this meme because this is always the way. You get all your stuff done, and then as soon as you're like, I'm going to take a rest, your baby opens their eyes. The other thing that is reassuring is that all babies are required to have a hearing screen before they leave the hospital to guarantee that their hearing is working. And if for whatever reason that doesn't happen, then we try to set it up as, in a clinic kind of once you've left the hospital, or if there's a problem with that sort of initial screen. Rashes are a big thing for babies. Their skin is really, really, really sensitive. They tend to kind of react to a ton of different things. But generally, especially in a young newborn, few days old, a couple weeks old, a lot of what's happening on their skin is normal. So this one here, you can see these little white dots. That's typically a benign newborn rash. It goes away in a couple weeks. Same with these little white dots. A lot of babies will have these sort of red splotches on their foreheads or on their eyelids or on the back of their necks. Those are another kind of common baby rash. It goes away. Some babies, especially those that have more pigment in their skin, will get these bruise-like marks on their back or on their legs. They're not bruises. They don't mean there's anything wrong. It's just an area where those cells that make color have gotten a little bit more stimulated. And so those also tend to fade. And then again, because baby skin is so, so sensitive, we will get kind of red patches and stuff that we can, put some baby cream on and call it a day. But if you are concerned about your baby's skin, definitely, call your doctor. That's what we're here for. So just as a reminder, we recommend putting all babies to sleep in a safe sleep environment. What does that mean? That means that you are putting them in a firm, flat surface, so a crib, a bassinet, a pack and play, nothing that is cushiony or pillowy. That you put them on their back to sleep. There's nothing else in that sleep space, so no loveys or blankets. If you are going to swaddle them, just keep an eye on what happens with that swaddle. You don't want the swaddle coming undone and now there's a loose blanket in the bed. I really liked these swaddles, that Velcro. I think they're the best invention ever. And then they should be in the parents' room for as long as possible. The American Academy of Pediatrics recommends until 6 months. And then as long as it's convenient for families, all that is just to keep them safe, right, in those early months of life. So how do we pick a pediatrician? This is a great thing, if you are looking for a new doctor for your firstborn, for your new baby, whatnot. So I'm a big believer in asking people for recommendations. So ask your friends, ask your neighbors and community whom they like to go to. And I think that's really important because they're living the experience with these doctors. You can read reviews online if you want, but really hearing it from people is the best way to find someone that you might like. Then you take those names and you kind of do a little bit of research. And what you're really looking for is, are they up to date on their medical license or whatever license they need? Are they certified, in pediatrics or family medicine? So are they a pediatrician with a board certified in pediatrics? Um, what hours do their office have? What is the call like, or what happens if something happens sort of after work hours? Like, how do you get a hold of someone? What sort of resources do they have? Um, what what do they feel about things that are important to you, such as using antibiotics to treat things or testing in the office, right? That sort of stuff. And then, if you can, doing a prenatal or a meet the doctor is really, really great because you get to then sit one on one and talk to that doctor and see if you like them. You see your pediatrician about 8 or 9 times in that first year of life. And so that's a lot of visits. And you really want somebody whom you connect with and feel like is your advocate and supporting you making these decisions when it comes to the medical care of your kiddo. All right, so what about vaccines? So our practice in particular has a pretty strict vaccine policy where we encourage all our patients to stay up to date with their vaccines. We won't take patients who decide to decline vaccines just for the safety of our other patients. That is something that is a decision of our practice, and every parent makes their own decisions when it comes to how they want to keep their child safe. So that is definitely something that I encourage all parents to ask when they are picking a pediatrician is, what is the policy? What do you guys suggest? Do you follow the CDC? Are you okay with alternative schedules, right? All that sort of stuff. And then these are my big one and my little one getting their rotavirus vaccine at 2 months. A quick thing about postpartum mood and anxiety disorder. So as someone who kind of lived through it, I'm a big advocate for screening and treatment. We remember that 1 in 5 women will have some form of mood or anxiety disorder postpartum in that first year. The first couple weeks, 80% of new moms will feel sad and weepy. That is totally normal. It's what's known as the postpartum blues. We know that happens. It has to do with hormone shifts and adapting to this new life and sleep deprivation. But really, if you hit that 2 week mark and you are not feeling significantly better, then we kind of get concerned that there may be something else going on. And it is normal and common and just a matter of getting the right support. I say this is me at 2 months with my first one. I was on my way back to work, looking super happy, but inside feeling pretty sad. So everyone, even your doctors, experience this. So do not feel like you can't ask about it, and ask about the resources that are available for you. So what is my number one advice to new parents in general is stay off your phone, stay off the internet. There is a lot of stuff out there that is not necessarily true. There's a lot of social media posts that make you think that if you're not doing something the certain way, you're being a bad parent. And I think sometimes just for our own sanity, it's easier just to disconnect. This is kind of my joking first advice, but what really my number one advice is babies need healthy parents more than they need anything else, right? So taking the time to take care of yourself as a new parent is really, really important to maintain everyone's health and everyone's sort of sanity. I really like to read, and it's one of the things that I enjoy. So doing those with my kids really brings me a lot of joy. And sometimes that meant not doing other things, which is, fine. All right, so let me see about questions. So we have a great question. What prep do I need and what should I add to my registry? So in terms of prep, I definitely think that if your hospital offers a tour of where you'll be delivering and any sort of baby education classes, those are always great resources. If your community has a breastfeeding prenatal course, that's also a really good resource. I think that getting as much information that you can to kind of help you with that adjustment to being a new parent is really, really wonderful. In terms of your registry, that really depends on kind of you. The basics, diapers, wipes, somewhere for the baby to sleep, somewhere for you to throw diapers away, clothes, pacifiers, all that stuff is really important. Then everything else is kind of extra and nice to have. You can get everything, wipe warmers and butt paste warmers and all those things. And if that's kind of what you want, perfect, put it on your registry. I mean, people are always happy to buy things. But I don't know necessarily if that's something you need. And that's again, kind of going back to my point um, about social media, that it makes you feel like you need a lot of stuff that you maybe don't really need. Okay, so another question. My baby will be born in the thick of cold and flu season. How do I keep her protected? And when do I know when it's necessary to bring her to the doctor? Okay, so um, all three of my kids, well, my older two were born in December, and my younger one, my youngest was born in September. So flu, cough season, this was kind of our life. So we generally recommend one, obviously keeping her up to date with vaccines to protect against things that you can protect against. Now with the new RSV vaccine, it is really important if you can get that either for yourself or your baby to keep her safe. Other than that, vaccinating the other people in the home against flu and COVID just to keep things from coming into the home is a great option. Other than that, wash all the stuff we learned, washing hands, using masks if you are sick, limiting contact with people who might be sick, are great strategies. And just, luckily newborns tend to kind of be in strollers or kind of in a carrier, so they get a little bit less exposed than bigger kids. But, again, I think the big thing is just trying to limit the amount of exposures. In terms of when you bring them into the doctor for a newborn, I generally will say if you have a question, you should bring them in. Newborns can get sick really quickly. They're little bodies with little reserve, and no one is ever going to fault you for taking your baby to be seen by their doctor. That said, if you want specific symptoms, if your baby is having a fever, so anything above 100.4 in a newborn or young infant, we definitely want to see them. If they're coughing and congested, if they're having a hard time breathing, if they seem extra sleepy, they're not eating well, they're vomiting, they're not peeing and pooping normally, anything that just seems kind of out of the norm is something we would definitely want to see your baby for. Yes, so car seats are super important. They won't let you leave the hospital without the car seat correctly installed, which is really nice. Um, Babies rear face in Virginia, at least until they are 2. Um, and in terms of where you can go to get it installed correctly, so any fire station or police station will have people there who are certified in the correct way of installing a car seat, and they are happy to sort of check that out for you. There are also people kind of n- n- uh, not in that setting who will also do it. There's people who are certified. So finding someone who is certified in car seat installation to just check everything is always a great thing. I would recommend doing that before you have your baby because then it becomes a bit of a rush, right, to get it installed correctly so you can go home from the hospital. Any other questions? Anything else? Is there a best practice for having visitors? We have a big engaged family and I'm worried about them bringing germs. Yes. So it is always a risk when you have visitors seeing your little one. It's one of those things that I think as, the parents of the baby should really sit and kind of figure out what they want and what their limit is. For me personally, when I had my kiddos in the middle of winter, my hard limits were everyone had to be up to date on their flu COVID. Well, it was prior to COVID. So their flu and their whooping cough vaccines. If they were sick, I had asked them to, not come until they were better or consider wearing a mask. Lots of hand washing, and all, those sort of things. Some families are a little bit less concerned with things like, if their visitors have all their vaccines or if they're sick and whatnot. And it's really just kind of up to the family about how much risk they're willing to take. I joined late. Do we talk about diaper rash and how to prevent? We did not talk about diaper rash. That is great. So, diaper rashes are pretty normal. Pee and poop can be very, very irritating to the skin. So in those first couple weeks, it's not uncommon for babies' behinds to get a little bit irritated. I'm a big fan of a thick diaper cream that has some medicine in it, like zinc oxide, because that really helps create a barrier between the skin and the poop and the pee, and it also helps heal whatever might be already irritated. The number one thing is to frost that bum up like a cupcake. So if you think about the amount of frosting that you would put on a cupcake if you're going to serve them at a party, that is about what you want your baby's behind to look like. So really frosted, lots of nice thick layer, and that generally is enough for most babies to prevent and kind of heal if they have a little bit of a diaper irritation. If it's more than that, then I would say you probably want to take them to see their doctor just so that if they need anything stronger or prescription, the doctor can kind of assess that. I don't know. Anyway, thank you all for joining. And right. Thank you so much. Again, I am Dr. Shea over at Farrell Pediatrics in Reston. Here's our contact information if anyone has any follow-up questions or just wants to learn more about our practice. Oh, I misspelled. It's supposed to be writing. And definitely, let us know if there's anything that we can do for you.
Thank you so much for joining.